Hello, a very warm welcome to yet another special edition of Middle East Matters with me, Sanam Shantier, and the team. Another week of coverage on how the coronavirus is impacting the health, socio-politics and economy of the region. On our programme, we'll be heading to Lebanon, where Hezbollah is trying to battle the spread of Covid-19, but opponents accuse the Shia group of taking advantage of the crisis. How is Egypt dealing with the coronavirus? We'll be delving into an array of issues with Egyptian author Khaled Diab, including authorities muzzling critical journalists and the ongoing debate over fasting during Ramadan. Also coming up on Middle East Matters this week, the search for a place to bury Iraq's Covid-19 victims continues. Many are concerned that the bodies will bring the virus to their locality. But first to Lebanon, which has so far documented a relatively low number of Covid-19 cases, which have also started to fall over the recent days. The pandemic arrived on the country's doorstep when it was already dealing with a sinking economy amid concerns that its health system would not be able to weather the crisis. And so it was Hezbollah, the political arm of which is responsible for the health ministry, that stepped in to offer up extra resources. But our correspondent Leila Molana Alan explains that their plans haven't been embraced by everyone.
No temperature check, no entry. These Hezbollah-affiliated civil defense officers are scanning drivers and pedestrians for fever as they enter Baalbek in Lebanon's Bekaa Valley, one of the group's strongholds. It's part of Hezbollah's crisis management plan to contribute tens of thousands of medics and volunteers, as well as ambulances and equipment, to the public fight against COVID-19.
حزب يعتبر نفسه مسؤول عن كل إنسان في لبنان، إن كان على الصعيد السياسي أم على الصعيد الخدماتي أو الاجتماعي. اليوم حزب الله هذا واجبه.
Lebanon's medical sector was struggling long before the virus hit. An economic crisis has left hospitals unable to import vital equipment. This private hospital is well stocked with ventilators and virus tests, but at a prohibitive cost for most Lebanese. At public hospitals like this one in Baalbek, where treatment is free, the designated COVID-19 ward is far more sparse. The hospital director admits they're not equipped to handle a crisis like this. That's where Hezbollah comes in.
We are concerned because the hospital is not ready for the influx of patients. Sometimes it's very difficult to get the medical supplies from the market here. So we may ask for their support.
While Lebanon has identified fewer than 700 cases so far, there are fears of a sudden outbreak. But Hezbollah's ability to provide specialist equipment has not yet been put to the test, and their scheme is controversial. Political rivals say privately funding a parallel health network to fill gaps left by the state is playing politics and undermines the delicate power-sharing balance in government. Hezbollah doesn't see it that way.
لبنان كله لحزب الله والحزب الله كله للبنان. هيك نحن نعتبر، ولبنان كله لكل حزب في هذا البلد وكل حزب لهذا الوطن. وليس فقط حزب الله. أعني بدي أقوله أنه يجب على الأحزاب جميعاً على الجمعيات جميعاً.
Critics accuse Hezbollah of taking advantage of the crisis to gain popularity and strengthen their hand in government. They say they're simply supporting the country through a national emergency. Either way, if Lebanon does face a mass outbreak, it's clear the government will need all the help they can get.
Now, there are a number of countries across the region where reporting on the coronavirus has become increasingly challenging. Among them, Egypt, where the infection rate continues to climb among the 100 million-strong population. The country has also come under fire for stepping up late and not imposing strict enough measures to tackle the spread of the virus. Their daily curfew only starts at 8 p.m. Now, for more on this, I'd like to welcome Khaled Diab to the programme. He's a journalist and author. Khaled, welcome back to the show. How has Egypt handled this crisis, in your opinion?
Difficult to say at the moment because the crisis hasn't erupted fully yet, but there's a lot that's not entirely reassuring, especially the absence of strict enough measures. There have been some strict measures like shutting down of places of worship, which is welcome, and stopping mass gatherings and so on. But the fact that there's only a curfew at night, that will not arrest the spread of the virus once it begins to rise.
Indeed, and for the time being, the streets are largely crowded for most of the day. Now, Egypt is, of course, one of the countries in the region that's been accused of initially ignoring the crisis. One of the reasons for that was because their tourism industry was only starting to recover.
Yeah, I mean, Egypt has a lot of economic and social reasons for having sort of delayed response to the crisis. So yes, tourism is a vital sector, both for the population and the regime and its cronies as well. But also, you know, a large percentage of the Egyptian population works in the informal sector, and they have no social security protection. So unlike, say, in Europe, where the state has been able to step in and sort of take up the slack for people staying at home, for a lot of Egyptians, it's a matter of survival. If they don't go out to work, they don't have food on their tables.
So, of course, the economy is an issue. And as I mentioned earlier, Egypt has been criticized for other things, one of them being that they've really tried to muzzle journalists that are reporting on the virus.
Yeah, I mean, they kicked out a Guardian journalist recently, Ruth Michelson, for reporting on a study by Toronto University, I believe, saying that the number of cases is higher than reported by the Egyptian government. Of course, the study hadn't been peer-reviewed yet at the time she wrote about it, but still, I mean, the question is, you know, lots of countries here in Europe, you get studies and speculation that the number of cases is far higher than the reported case, and no journalist has been, you know, muzzled or arrested for that. The Egyptian state is incredibly sensitive when it comes to anything it perceives as criticism. So that's one problem, that it's very intolerant of criticism. But also another problem is that they're afraid of public panic, especially given how low public trust is in the state and its institutions.
Now, Khaled, the last time I hosted you on this program, we discussed Islam, and interestingly, religion is coming up in the debate in Egypt, to fast or not to fast during Ramadan, which is, of course, coming up later this month.
Mm-hmm. I'm not a medical professional, but I can understand why fasting and going without, you know, food and water might make you more vulnerable, especially if you have underlying conditions. So I guess it would be like the, you know, normal Ramadans, if you're somebody who's in one of the vulnerable groups, it might make sense for you not to fast, I guess. But like I say, I'm not a medical professional, but I do know that fasting has a lot of complications for people, you know, medically speaking. So, you know, it wouldn't surprise me that people who are vulnerable should be careful when fasting, definitely.
Now, Khaled, of course, the global race, as we know, is very much on to find a treatment, a cure for Covid-19, and Egypt has become a contender. Do you think that it does stand a chance, given that Egypt has what we refer to as an underdeveloped research sector?
I mean, I would love for it to happen as an Egyptian. It would make me incredibly proud if Egypt could contribute to this. But, you know, there's a lot of talent in Egypt, a lot of scientists and researchers, a lot of very intelligent people around. But the trouble is that, like, we don't have the research infrastructure. We don't have the R&D spending. We don't have much of an open academic culture. You know, there's a lot of suppression, like, you know, superiors suppressing the research of, you know, juniors and so on. So, you know, it would be great, but it's unlikely that Egypt will make a major breakthrough. And I don't think public confidence is very high in that possibility of it occurring, because there have been a lot of claims by the regime that they've cracked this or that disease in the past, and they've all turned out to be false.
Khaled Diab, author and journalist. I'm afraid that's all we have time for. I'd like to thank you again for speaking to us here on Middle East Matters about the crisis in Egypt. Now, we finish our program with Iraq this week, a country of more than 38 million people, which has only recorded around 1,500 cases of Covid-19. Now, while the numbers are still relatively low, certainly in comparison to other countries like neighboring Iran, there have been questions over where to bury the victims. Now, this as scientists report the first case of coronavirus spreading from a dead body.
Bodies are building up in the Iraqi capital, Baghdad. The authorities have decided that for sanitary reasons, coronavirus victims cannot be buried inside the capital. Families are posting desperate pleas on social media, like this one. Abdul Hadi's father's body is lying in Euphrates General Hospital. It's been more than a week and his body still hasn't been buried. What can we do? The authorities have started burying coronavirus victims in the surrounding region, sometimes with no families present. This video caused outrage when it was posted online. One person wrote, "They shouldn't pull on the body like that. They should carry the coffin on their shoulders, and they should be wearing masks and protective suits. You don't do that kind of work in a jalaba." Another said, "No respect for the dead. They would have done it properly if the family were there." We spoke to a group of volunteers who offered to escort 8 bodies for burial in a town east of Baghdad, but the locals refused. The families decide to try another town, even further from the capital. They are furious at the health ministry.
احنا صار لنا 8 ايام اليوم يلا طيتونا الجثه مالتنا وجايبينها بجوله على دياله 3 ساعات نمشي بهاي الجوله باعوا حتى شوارع ما مبلطه جايبينها بجوله تعالوا دفنوا هنا.
But the locals refuse again. Eventually, the city of Najaf agreed to take the 8 bodies. They were finally buried at the Wadi al-Salam cemetery outside the holy city on March 30th.
لأن هاي الجثث ما حد دفنها لا إله إلا الله لا إله إلا الله.
That was Derek Thompson from our Observers team with that report. I'd like to thank you for watching another special edition of Middle East Matters. Do stay tuned.